Well, it actually depends on the country in which she lives. In many countries, it will mean that the family totally loses their caregiver. In other countries where women are so devalued, there may be a sister or someone else who marries, who comes in, because it's really not so terrible if someone dies in childbirth. We'll find another woman to come in and take over that role. So there's huge cultural variation. But even if another woman does come into the household very quickly to take the place of the woman who dies, the children, of course, are going to suffer emotional loss, even if they don't suffer other loss. So we're talking about, the pillar of most societies, which is the woman who often holds the family together, who often produces the food that people eat, who may contribute to the income, even if it's not a cash income, the income that enables the family to survive. But it varies, and I think one of the reasons that many of us who are women feel so passionately about it is such a gender-divided issue. We don't generally devalue women. We don't devalue men as much as we devalue women in many societies, and that means the deaths sometimes are not taken as much notice of as many of us would think is important. And I guess it's very interesting for me because the reason that I started fighting for this, not just overseas and in other countries, but in Australia, was I saw women treated extremely badly by a gendered health system in Australia, where they were treated, I think, with discrimination, without respect, without care, and not necessarily as intelligent human beings. And as a young woman myself, I got very angry about it. So I think that there is an issue there for not just economic but social disparity and social inequality that gets reflected in maternal death in childbirth.